Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go over the traditional dashboards that we go over on Mondays, which is basically the two from Austin Public Health. We'll take a quick peek at the University of Texas model, and then there's a new dashboard on the Austin Public Health website that deals with vaccinations, so we can see the demographics of vaccinations. That's a new website just up this weekend, so we'll take a look at that. But let's begin with the dashboards. We'll start with the key indicators for staging, and you can see this number we always look at: 7-day moving average, hospitalizations 55. That's getting us down here in red. The modelers told us that Dr. Escott could go into stage 4, orange, somewhere between 50 and 60. My sense is he's getting close to doing that. We're looking at 12.4 positivity rate last week. The actual number for Austin Public Health down a point or two lower than that, but this past week it was down a point or two even lower. So I know Dr. Escott's looking at a lower positivity rate. He's looking at a 7-day moving average, which is going down. 44, by the way, were the new admissions today. 7-day moving average at 55. You can see we're below the 7-day moving average. So I would expect Dr. Escott to do that shortly. Let's see what he does. Number of new cases today, 448. I'm a little concerned about that, up above the 7-day moving average, which continues to drop. The 7-day moving average yesterday was 443, so it's down to 410, even with the 448 number. So the 7-day average continues to move down. Number's a little bit higher. I'm going to be nervous about that number for a while, because we know that some of the variants have made it to Austin. The UK variant has made it to Austin. We've picked up cases both on campus and off campus. If we're seeing cases, that means there's a lot more cases we haven't seen. We know from the UK that that virus spreads a lot more quickly. Some indications that it might lead to more serious consequences, but it also looks like a virus that is arrested or mitigated with the Moderna and the Pfizer vaccines. So we have to make sure we start getting that vaccine for more and more people as best we can. Let's go to the next dashboard. This is the one where we take a look at the actual number of hospitalizations and ICUs. This is the Travis County public dashboard. Let's share that. Here we are. We can see the number of hospitalizations at 446. The 7-day moving average is 473, so we're below that. Of the 446, 39 of them are in the alternate care facility, the site. That was the same numbers we had yesterday. 133 number in our ICUs tonight, intensive care units. The 7-day moving average is 140, so we're below the 7-day moving average, headed in the right direction. Ventilators at 96, the 7-day moving average is 95, so we're one above that. This is the number, the 133, that we wanted to make sure didn't go over 200, where we were just a few weeks ago. We were up above 190, so it's good that the ICU number is coming down. Total number of new cases went over 72,000. The number of deaths at 689 represents an increase of 5 families mourning the loss of someone in their family. Tomorrow we'll get Dr. Escott's weekly revised numbers, so a lot of numbers to go over tomorrow night. That'll include the weekly hospitalizations by race and ethnicity. Let's take a look at the University of Texas model so we can see what they're predicting The number went up by just a little bit. The R factor went up by just a little bit, but it's still below 1. So let's take a look at the University of Texas chart. You can see it's 0.85 is the R factor that we're looking at right now. I think this number yesterday as of 2/4 was 0.81. So it's gone up, but not very much. This is as of 2/7, so a more recent number. Green are the dots that show you the actual hospital admissions that we have in our MSA. This aqua line here is what they're projecting. Dr. Lauren Myers and her folks. You can see it's kind of flat, but headed down a little bit. That's what 0.85 shows us. Hospitalizations heading down the same way. ICU admissions continuing to head down, getting further away from the 200 line, which was right here when we were getting really close to that line. So the UT model indication based on the data, based on the admissions, is and then incorporating not only those numbers, but also the mobility data that Dr. Myers takes into account is showing an R factor going down. Yet another reason why I would anticipate Dr. Escott taking a look at the stage levels. We'll talk about that going from stage 5 to stage 4 if that happens and what those differences are. One difference is that it allows for social groups of greater than 2 going up to 10. Dr. Escott allows for greater occupancy in restaurants. What he recommends, it's already exceeded by what the governor allows. But we'll talk about that if and when that's something that happens. I do want to share with you the new numbers that we have with respect to the dashboard. This is a dashboard on vaccinations. You can find it the same place that you let's see if we can find it here. The same place you find the other dashboards on the City of Austin website. The COVID dashboards, and there's one that's called vaccine distribution, and that's the one that you want to find. This is the new dashboard right here. So let's go ahead and take a look at it. It has the total number of vaccines given as of the end of the week 129, 31,251. We know that in the ensuing week, that number got to just under 40,000. And so that number lags just a little bit. The cumulative doses, 31,251. The doses in that prior week, the 8,021 was what had gotten out in the 7 prior days. Now, the targeted population that we're trying to reach are folks over 65. But in that first group, we'd also included in the A1 group a lot of healthcare workers, included the physicians and the nurses and others. So we picked up a lot of people that were under 65, but were in that very first group of healthcare workers. But if you look at the total number of cases that are 65 and older, that is 5,071, 64 and under. 2950, and that makes for the week's doses of the 8,010. This is where we can track if we're getting to the desired population right now, which are folks over 65, and you can see that we're doing that at over a 2-to-1 ratio. To understand the numbers that we have, total population in our Travis County is just under 1,000,003, the 1,273,954 here in the upper left-hand side. The total of our population, 65 years of age or older, 129,438. That's about 2% of the total population. Of that population that is 65 years and older, 68% of it is white, not Hispanic, 18.1 Hispanic, African American 7.6, Asian 5.1, and some other 3.9. These numbers aren't exactly right. If you add them up, they don't equal 100. I don't know exactly why that is yet. I'm checking on that, but these are roughly the proportions. You can see them right here. We know that the Hispanic population in the community is up at 35%, roughly 36% in the city, but it's a lot of younger folks, a lot of folks under 18. A lot of folks between 18 and 65. That's why just the Hispanic population, the Latino population over 65 years of age is smaller. The overwhelming number of just old folks are white. Younger folks are the communities of color. And then you can compare what these percentages are with respect to this section down here, which shows you the demographics of the doses administered by Austin Public Health. You can see that of all of the doses given by Austin Public Health, and remember, this is just Austin Public Health vaccinations, doesn't include Seton, doesn't include St. David's, it doesn't include CVS, it doesn't include these other entities because they don't give their data to us. They just turn it over to the state. So the only data that we have for sure is the data that we're giving out at Austin Public Health. You can also go onto the website of Community Care and see what their demographics are of the vaccines that they're giving out to their patients and clients. It's a much smaller number, but they're also being transparent with their numbers. But in Austin Public Health, 64% of the vaccines that have been given have gone to white, not Hispanic. White, non-Hispanic population over 65 is 68.2. The Hispanic population getting vaccines from Austin Public Health, 18.9% compared to 18.1% over 65 in the community. African American population is the one we're really missing on, about 4%, but we know they're 7.6% of the over 65 population. And the Asian community, 7.9%. Just over the 5.1% that the Asian population is in our community. We need to work on these numbers. It is the goal of Austin Public Health to increase these numbers so that the numbers of the folks that are hardest hit by this, the Latino community, their percentage goes up above the 18.9%. Above the 18.1%, so that we're not just doing the proportion of that community in the population, but we're also taking into account that that particular ethnicity gets hit harder by the virus, as does the African American population. So it's not good enough for us to hit the demographics in the community. We have to go past that. To that end, Austin Public Health now is on the phones calling the people that are most susceptible before the site opens up with new appointments to urge those folks to look out for that, sending emails so that they would get that, but also calling people that don't have access to the computers so we can try and push up these numbers. From week to week, that's what we're going to be looking at to see if these percentages here go up. By the way, it's 58% female and 41.5% male. You can also see what the age proportion here is of folks that are getting it. You can see the biggest group here are the group of folks over 80 in their 70s and in their 60s, taking up a big piece of the pie chart that we have. We'll continue to watch this site, this new site, as we move forward. That gives you the total number of vaccines that we saw in the city. It gave you the population. We've been through those numbers. The colleagues on the council also pointing out the disparities with respect to the percentages and urging the city, Austin Public Health, to really redouble their efforts to make sure that we're getting it out to the communities that need it the most. Again, the whole vaccine delivery is frustrating if you're over 65 or a susceptible population and you're eligible because you can't get the vaccine. and that's frustrating. The main reason for that is we have insufficient supply. You saw, over 100,000 people over 65, and we've only administered, by that chart, a little over 30,000. In actuality, just under 40,000. So most of the people that are eligible, just looking at the ones over 65, there's just not the supply of vaccine to be able to get to them. We are hopeful for more vaccine in the coming weeks. We're assessing our system to ensure the vaccine gets out to the communities most equitably. And when vaccine comes in, I promise you that we're getting it into people's arms right away within the week. And then we've been asking the state. I was with Dr. Hellerstadt, who's one of the key folks for the governor. I was with him this weekend, telling him that we can get out 10 times as many vaccines as we're getting in our allotment thus far. We get our proportionate share by population, but we need for the state to get more from the federal government. And talking to the intergovernmental folks at the White House in the new administration, they tell us that they think more supply is on the way here in the coming weeks, not only more production from Moderna and Pfizer, but also we're getting closer to approval of the Johnson & Johnson vaccine, which is just a one-shot vaccine. And we'll talk about that vaccine as it looks closer, if it gets approved, and it looks like it could be heading our way. I think at that point, if it ever comes here, we'll be giving people in the community a choice between having a one-shot vaccine they can get more quickly, or waiting a little bit longer and getting the two-shot vaccine. But we'll talk about the pros and cons of both of them. Just a reminder that this past week in policing, we approved the creation of an independent forensic lab, moving the forensic lab out of the chain of command to the police chief, putting it under the city manager, makes it more independent, ought to increase its credibility in jury trials, where the juries look for independence and that kind of work. We're continuing to make more progress on kind of the reimagining public safety issue. Give you an example. Beginning this month, when you call 911, the call center, it has a new script. They'll say, hello, 911, and then they'll ask, do you need police, fire, or EMS, or mental health? It used to be that they would just ask, do you need police, fire, or EMS? They're now going to ask police, fire, EMS, or mental health as part of the 911 script on the introduction. We're told that we're the only city in the United States, certainly major city, to change our calls in this way. And I'm proud that we're doing it here based on our community conversation. It's certainly something we wanted to see more of, to get more mental health first responders processing and vetting and triaging those calls to see whether or not it's something that our police need to respond to, or whether a mental health intervention should be the first thing. It's important because this is part of reimagining public safety. It's part of enabling our police officers to focus on crime. This new system, we hope, is going to help us reach our goal of transferring calls that have a mental health component, that don't pose a risk to public safety, away from law enforcement. And as we see that, if that's successful, obviously that would begin to impact perhaps the number of police officers we need, and the support that we need to give to mental health first responders. That's all for tonight. Tomorrow night, we will have all of the slides and data for the computer chart data nerds that we get from Dr. Escott on Tuesday. With that, good night and be safe. And I'll see you tomorrow night.